Clinton from the Heart of Medicine, and today is July 22nd, 2025. And this video will be specifically regarding how to improve your efficiency and how to do well when you are on call on a very busy service. And I've been on call by now many times. So I was on call in Costa Rica over 24-hour shifts, approximately every 6 days for 5 years. So that was about 305 shifts. I did the math, times on call, so that would give me some sort of experience. And here in the US in internal medicine, call days were 12 hours, so I wouldn't count that necessarily as a marathon, right? The marathon is probably 24 plus 24 hours. That becomes a marathon. That will test you emotionally, physically, spiritually, everything. When you are on call for 12 hours, you can make it without necessarily taxing your psyche, taxing your health, etc. So for anyone out here seeing this, well, this is going to be specifically for a cardiology call in a busy center, but you can, of course, use this analogously to any other call where you are working a lot. So my experience, yeah, you are the busiest person in the hospital. When you're on call in Costa Rica in internal medicine or also in cardiology, you're one of the busiest persons. And also when you're on call in cardiology in a busy US center, you are also probably one of the busiest persons in the hospital. So what are the main points? And I'm sharing this information because I was asked this question by my peers, because I was probably the first person who had to do call on 2 different days. One day was a Friday, so I entered at 7 a.m., left the next day after I rounded, approximately it was like 10 a.m., and I went to rest, and then on Saturday, and I came back on Sunday, entered at 7 a.m., and the next day, meaning Monday, when I finished rounding on my patients or presenting them, I left, so also approximately around 10 a.m. So whenever you I'll give you this analogy. So whenever you test yourself running, you might run a mile, 2 miles, and almost anyone in acceptable condition can run 1 or 2 miles. So that's not gonna be too taxing. But when you have to run over 10 miles, a half marathon or a marathon, that's when you actually figure out what you're made of. So if you want to know who is a great person with a great attitude and all that, see them when they are post-call in a plus 24-hour call. If after 24 hours this person is still smiling and all that, that's a very strong, resilient, happy person. Because you'll notice most people that are post-call plus 24 hours, they aren't very interactive. They are just focusing on the task at hand and getting out of there, basically, to go rest. So these are the main tips I would give you if you're seeing this video, and leave me comments, feedback, anything, etc. Right? Like, dislike, anything. We're here improving. So one of the most important things is be time efficient, and remember, every second matters. So oftentimes, maybe you haven't gone to urinate or pee in a couple hours, and you feel like you have the urge to go pee, and you get this new consult and it is nothing emergent, but you're very near to the patient's room. I would tell you, go pee, because you never know. You might go into that room with the urge to pee, and you might find out that this patient basically becomes time consuming and one thing after the other. And when you notice, your bladder, it has undergone a stress test, basically. So make sure to have those pauses to go to the bathroom. Make sure to hydrate yourself. There's no reason that you should go the entire shift without drinking anything. There's no reason that you should go the entire shift without pausing at least 30 minutes or 2 times 30 minutes to eat, to make sure you are well fed. Because, for example, when I was in Costa Rica, I would do these shifts and I would just keep on working, and sometimes you have this sympathetic overdrive that is just avoiding or blunting any urge to, or any, your appetite. You just go on, and I started having some epigastric pain and started having some GERD-like symptoms, and that was because I basically wasn't eating and I was just going straight through the shift, working, and all of a sudden maybe I had a 1 hour moment where I could maybe rest or sleep. And since I hadn't taken the entire shift, I decided, no, I'm so tired, I just have to fall asleep. So I had done maybe an intermittent fasting for 15, 16 hours, and then I took that very needed nap, and then you had to keep on working. When you add those on and on, that becomes a problem, and all of a sudden you are having GERD-like symptoms and reaching out to a gastroenterologist to see if they can do an upper endoscopy for you, for example. So you don't want to get to that extent, so make sure to take care of yourself so you can take care of others. So that is vital. If you aren't fine, if your brain isn't working correctly, imagine how this can affect the patient's family, all that. So for example, in the hospital I'm at right now, the view is incredible. So even if you're tired and you're passing through a section of the hospital that has an incredible view, just pause, look out the window, breathe in, just regenerate those batteries, right? And that will help you a lot. And that's not something I say lightly, because if you don't take those pauses and you think you're a robot, what will happen is that you do great, but when it's 3 a.m. and you have to go see a patient real quick, and a family member stops you in the hallway asking you something that isn't emergent at all, you might answer with a angry face. You might be unpolite, and you don't want any of that, right? So you want to have that mental and emotional stability and peace, and the way you do that is through nurturing it, and you have to nurture these things throughout the shift. There are some shifts that are almost impossible for you to nurture these things. So whenever that happens, whenever you go in there and you're expecting to rest at least 1 hour and you don't get it, I would recommend you to have this mindset, which has been passed on to me, which is, if you are able to rest, that is a blessing. That is extra credit. Don't expect to be able to rest. Don't expect to have an hour or 2 hours of sleep. Expect to go in there into a battlefield and not have any rest whatsoever. and any extra moment you get is a blessing. Okay, if you have that mindset, everything that can come out of there, it's either neutral, because if you didn't sleep at all, that was what was expected, but if you get 1 hour of rest or 2, sometimes even 3 or 4, that was incredible, right? But what I have had in the past is, for example, in Costa Rica, I was thinking, okay, I'll use my call day to start to study. I want to study. I want to work on a lecture I have to give. I want to do this, that, and all of a sudden you open your computer, and as soon as you open that, boom, the beeper goes off. You get these text messages one after the other, and then you're all of a sudden like, I just want to be able to study. I just want to be able to advance a little bit on this lecture. I was planning to have a moment. So that takes me to the next point, which is also arrive prepared. By prepared, I mean that you have to be well rested on the day of your call. So in general, try to be well rested. But we understand that life happens. But when you are going to be on call, if you're going to be on call tomorrow, today is not the day to go out and have a drink and stay up late and hit your body too hard, because tomorrow you need your batteries at 100%. So yes, when you're on call, make sure the day prior to that, you take it easy, you're well rested, and of course, plan in advance so that you don't have to be stressing out the day prior to call or the day you have call. So depending on where you are and in which country you are, you might have to be working and going to sleep at 1 or 2 a.m. on the day basically of your call day, because you have to present the lecture, and maybe it was the COVID pandemic and you had call shifts plus 24-hour call shifts every 4th day. That makes it almost impossible for you not to be busy doing something on your pre-call day, on your call day, and on your post-call. But in most instances, at least in the United States, it won't be so extreme, and you'll probably have time to organize well so that you don't have to stress the day pre-call, the call day, or post-call day. Those are days that you have to pre-call and post-call day, rest, take it easy. And on call day, you have your battery at 100%, because you know that that's going to be a battlefield, and as soon as you go in there, maybe you won't have a chance to barely go to the bathroom to have the bodily functions satisfied. And that's happened to me in the past. I've had these call days. I remember in Costa Rica that I had to be on call in the emergency department, and we had paper charts initially, and I would get in there at 4 p.m. because they were already waiting for you so they could leave, and we were seeing all the emergent patients, medically emergent patients, and you would arrive, and over the table there were all these charts that you had to start counting, and you're like, 12 patients. You're like 12 patients waiting to be seen, like, and you see how they're triaged and their color. You didn't see color green, so you didn't see what it was. No, you did see color green. So green, yellow, and if there was a red patient, that you were called immediately because they were taken to the shock suite, right, or room, which you also had to handle. So that was crazy. So we were a couple people in charge of that, and that builds resilience and builds the tools to be able to give these pointers. By no means I believe or am stating that I know it all, but I think that I have enough of these reps to be able to increase some efficiency. And as I go, I will be sharing with you guys more ways how to increase the efficiency. So you get there, you have 13 files over the table, you have to go through each, you have to triage and prioritize, okay? This is another extremely important thing for time efficiency. So by triaging, I mean you have to figure out of these 13 patients, which of them have to be seen right now, like in the next 15 minutes. And for that, there are good scales, but you remember that patient's condition can change from one moment to the next. So you you have to triage, and as new patients come in, you will have to reorder these patients. That's why many patients in emergency departments, and you see it on the TV series, they are very sometimes pissed off because they want to be seen like this, and they're like, this person got here 1 hour after I did, and I have to be seen, and they're knocking on your door, and you have to explain to them, this isn't first come, first serve. This is the most acute will be seen the quickest, and the one that can wait will have to wait because there's only so many hands we have on board, right? So that's what I want you to do, triage. So if you're in the ED, you do that. If you are not in the ED and now you're a consultant and you have a pager, you see all the pages, and as soon as you get them, try to get them out of there. So as soon as you get them, you call and you see what's up, and then you're like, okay, this one is like, I have to see this one now, this one can wait. And it's not like you're just seeing these pages because you want to delay things and you want to rest 5 hours. No, that's not the reason. The reason is because you have so much work that you have to be well organized, because you don't want a lot of work to clump up and then you have no idea what to do. So the recommendation here is, as soon as you get a page, you call them, you ask as many necessary questions you need with respect and all that. There should be no problem, because you are the one that is going to be in charge of a lot of patients. So if you have to ask, hey, when was the last EKG for this patient taken? Okay, and oh, it was 3 hours ago. Can we do another EKG? Because I'm very busy right now, and I understand you're also busy, but if you could get an EKG and you could send me the picture, that would be extremely helpful, this and that. And no one should get angry on the other line. Like, if they can help, perfect, and if they can't, they'll tell you, hey, I'm worse than you are. So at least you know that they won't be able to help, and you will have to go and sort it out yourself. So remember, we're a team. So yeah, prioritization. How do you prioritize? So don't rely on your brain 100%, because you will do great at 8 p.m. But guess what? When it's 4 a.m. and when it's 6 a.m. and you're signing out and people are coming in and asking you, tell me about this patient, you might not even remember like the story of this patient. So this is where I'll tell you, write it down somewhere. So you get a page immediately. If you use a medical record such as Epic, which is great, you can put in the handoff section, in the handoff tab, or you can put it on the yellow sticky note, or you can write it down on a piece of paper, or you can write it down on somewhere. You can write down one-liner. 87-year-old female with not necessarily maybe past medical history unless it's relevant, with syncope, has dual chamber pacemaker ICD, and a concern for abnormal pacemaker functioning, whatever, right? So you write that down, and also, if you can, you write the acuity of this patient. So you can use whatever. You can use happy face, neutral face, and sad face, okay? Or you can use colors, or you can use an arrow, whatever you need to know. Very important, top of the list, intermediate, and low importance. Remember, a whole lot of those consults or calls you get are low importance. You know it. And that patient, yes, they will have to wait till after you make sure there is no ST elevation in this patient. You make sure that the potassium of this patient is no longer 7. And after that, you go and see those. Okay, so next thing is, I already talked about prioritization. Next thing will be, okay, you're part of an interdependent team. So remember, no man is an island on itself. So I think that's the quote. So you cannot do everything on your own. So you have to be respectful. You have to also make it count. You can't be false nice, because people will notice it. And if you're going to work there for years, eventually people will take out your cloak and know, oh, this person's not a nice person, and they're being sarcastic all the time. And then they don't want to even help you. So you have to be nice all the time. And people will understand that you might be way too busy and might not remember their name maybe and all that, but just be nice. And by being nice, you will get the team to work better, more efficiently. That means learn how to delegate tasks. You might be so busy, you might have to delegate and tell the nurse, hey, I need this device pacemaker interrogated. I would love to do it myself, but please, can you go ahead and do it? Because they know how to do it in the emergency department. And tell me how it is, right? And that way you're advancing in other things. Or maybe you're so busy that you get a consult from the emergency department for a patient with, I don't know, bradycardia, and you're like, no, this doesn't add up. And you see there's no note, there's no labs, there's no nothing. You can tell them, hey, can you please order for me basic labs and get vitals and orthostatic vital signs and all that, because that would help me when I go see the patient. And yeah, that's a possibility, of course, if you're very busy. So work with the team. This will take me to the next point, which is closed loop communication. Never assume absolutely anything. Never assume that you ask the nurse and you text them, hey, please give IV Lasix 40 milligrams stat, and the nurse read it. You can see the notification that it is read. Don't assume that it was given. Yes, you have to confirm. You might be way too busy, and some things might go through the cracks, but ideally, you should confirm it. Ideally, the nurse should reach back out to you and text furosemide 40 milligrams IV given. If they don't, you have to reach out again. Because if you're doing these things during the call day, it's probably because you need them done. And that takes me to another point. If there's things that won't make a change today, that can wait till 2 days from now, probably you shouldn't be doing them today during your call day. Because if you are one of the busiest persons in the hospital and you're fixing things that are minor and you're ordering melatonin for the patient that can't sleep, and you're going through the history of the patient and trying to help the family figure out if the patient had hypothyroidism 10 years ago due to Hashimoto's, or it was that the patient lived in a iodine deficient place, like, is the patient hypothyroid now or no? No, they're not. So, okay, I'll leave that to the primary team. And sorry, I'll have to move on, and please ask them tomorrow, or I'll see this patient tomorrow and I'll have more information about it, okay? Then, what else? I already talked about wellness, sort of, so make sure to do that. Part of wellness is nutrition, is getting a little bit of rest. Yes, if you can lay down, close your eyes, do it, 100%. But make sure you are reachable. Don't be, if you're a person that if you fall asleep, you don't listen to a phone, and you know that you're difficult to wake up, if you have OSA, maybe you should be well treated and well controlled on that, and not fall asleep, or have a mechanism that if someone reaches out to you, they can get to you. So in my case, I have very light sleep, but sometimes in Costa Rica, I did have my alarm there, it was like nearby, and nurse would tell me in the morning at 6 a.m. we were trying to reach out to you. This happened to me once. I was in charge of the codes and all those things in Costa Rica, and I just went to sleep. I remember I was sleeping on the second floor of the bed bunk, or however that thing is called, and all of a sudden I get a call. I answer, hello, like 3 a.m. Where are you, Dr. Clinton? And I'm like, I'm here in 4th floor of South Tower. This patient, there's a patient without a pulse. Without a pulse, he's coding. We've been calling you. You're not answering. I'm like, I have my phone here. I'm sure I would answer because I have my phone and I have no lost calls. I'm on my way. I'm like, let's not argue right now. Tell me which room it is. It is M3, medicine 3, and room number 13. And I'm like, I'm gonna be there. Please go ahead and start chest compressions, because in Costa Rica, oftentimes, even like not many people were giving chest compressions, even if a patient coded. Sometimes you were expected to get there, do chest compressions, run the code, take time, and then write the report. Yeah, that happened. So actually, yes, I confirmed, and I'm like, please give chest compressions right now. I'll be right there. I jumped off the bunk bed into my Crocs, ran down 1 floor, got there, and the nurses are staring at me like this, several of them, and they're like, aren't you gonna give chest compressions? I'm like, please go ahead, please go ahead and give chest compressions while I see the chart of this patient and know what's going on, because I was going to leave the code, and how can I give chest compressions and then tell me about it and you're not getting information? I wanted to see how electrolytes were, a little bit of story of this patient, because mind you that I had 30, 40 patients in charge, so you don't know the stories of these patients. You don't have time to review all these charts. Okay, so basically, that happened. They started giving chest compressions and all that. And after the code ended, I told them, hey, we have to talk about this. Someone was saying that I wasn't getting my phone, that they had called me and I hadn't answered. And this is very serious. This was a code. So this is not the case. I'll show you my phone, who called me, which phone calls I have. That's not the case, because I would have noted it, and it wasn't for the sake of argument, but there's some things that you have to be assertive about. There's some things you have to communicate, because what if this patient had coded for 5 minutes and the nurse knew it and maybe told you 5 minutes later, and all of a sudden they're saying that you were called and you didn't do anything. So yes, closed loop communication. There has to be very clear things. That's why there's debriefing post-code. That's why there's debriefing in many areas. Whether people like it or not, debriefing is how we grow in any significant and non-significant event. So closed loop communication, use your team wisely, prioritize wellness. So by wellness, the last thing I will add is exercise. So I would recommend you to try relying as least possible on energy drinks, on caffeine, on all those things that might be synthetic. Try to do it as natural as you can. So something that I do is I exercise and I drink water, and I don't load myself with carbohydrates. So I get a carb crash. Most people get a carb crash if you eat a lot of carbohydrates and you're sleepy all day. So test it. Go a day, intermittent fasting, one single day, and you'll see you'll be crisp the whole day. You won't be yawning. Actually, yes, you'll want to eat, but you won't be sleepy, right? And anyone here that sees this, that is very sleepy, and that you need energy, give me 20 push-ups, give me 30 squats, and you'll see you won't be tired. It'll give you at least a couple hours of energy. So that's my recommendation. And other than that, don't take anything personally. Nothing. Like, yes, you're already in a high stress environment. People oftentimes are not reacting to what you do, but they're actually reflecting on you, their inner self. So don't take it personally if someone just yells at you over the phone. Like, I just saw the other day, one upper level of mine had spoken, had got in a page and called, and I'm like, I got a page from this number, and the person on the other side is like, nope, I didn't call. And my peer is like, well, that the page says this name, this person was calling. I wouldn't call if we didn't get the page. And the other person was like disrespectful, but we didn't take it. No one took it personally, and you just leave it there and move on. There's no time to get emotional here. We just have to move on. And if you want to vent, perfect. Like, if you have a moment during your shift that you want to vent, you can call your upper level and tell them. But during these moments that everyone else needs you, just breathe in and know that you'll have a moment to vent. You will have a moment to rest eventually. And yeah, hopefully you are in a supportive group. So if you're not in a supportive group, that sucks. I've been in many places in the past, and right now I'm in the best environment I can imagine. I didn't even think I could find such a good environment. I'm blessed right now, but I've gone through those environments that you're like, oh man, like, this is gonna be tough, and you feel like people are just trying to make you fall at every corner, and that you don't have exactly teammates, but some people might be going against you. Oh, it's so difficult, right? So if you're in a bad environment, trying to improve it. No, don't continue the same trend. Don't let that get into your head. Remember, you're more than that, and that's how we make a change. And I just kept consistent. I kept on working hard, and look, I found an environment where everyone is supportive, and I've just been supportive irrespective of people supporting me or not. That's not about you. You can do what you can do, and you can control only your variables, okay? So that's about it. Nothing lasts forever. Pain does not last forever, and make sure to take care of yourself. I've seen so many people that go into these residency experience, and in 3 years, when they get out of the residency, they've gained, I don't know how many pounds. Their hair now is completely gray. They have had these back problems, and they now need a surgery. All that has happened. Like, I have gone through similar things in Costa Rica. When I was in Costa Rica, I remember one time we needed a central line. No one could get the kit. I had to run, and I hit my finger going up the stairs, and I broke one of the toes. I think not the big toe. I broke one, and yeah, that was one thing that happened. Then one day I got stuck with a needle because I was just trying to get all the point of care glucose. Believe it or not, I had to get that as an intern on all the patients, because that hospital where I was in said that no, nurses are not doing that. It's the intern or the doctor. So I just got stuck because I wasn't organized enough. And those things happen. So always remember, better. There's a book that says, think slow, right? Think slow, but well, that's what you want to do. You want to think efficiently, and sometimes taking a step back, not answering immediately is what's going to take you further. So last point here is, whenever someone tells you about a patient, whenever someone wants your input on a patient, never just say whatever's on the tip of your tongue. Always think about it, because your decision might generate problems. So oftentimes you will have a minute to think about it, and trust no one. So yes, eventually you'll learn that, oh, this guy, whatever this guy says, I can trust it blindly, but that takes time. But I would recommend you, always initially, don't trust absolutely anyone. If someone says, I don't know, this patient is in cardiogenic shock and we want you to see him, I will listen to it and I'll hear them, and they might tell me the different variables they assessed to come to this conclusion. But believe me, when I go to see this patient, I'll ask my own questions, I'll get the information, and it's better for you to tell the patient, hey, I would like to know about you. I would like to know your story in your own words. Tell me why you came to the emergency department. And oftentimes the patient will tell you a story that is completely different. So sometimes you are sold a story that this patient came for a syncope. And you go speak to that patient and you tell them, hey, tell me in your own words, please. The patient is like, I had a little bit of lightheadedness, a little bit. And I was seeing like some weird things, like light intensity was a little stronger. And I was also having a headache. And I'm like, did you fall down? No. Did you like lose consciousness? No. Have you had this in the past? Yeah. Actually, I've been told I have migraines. And I'm like, okay, was this similar to that? Yes, doctor, it was the same thing. I'm like, okay, so that's it. So the patient gave you the information. If the patient is alert oriented times 4, and there's no concern for you that this patient is maybe trying to basically change stories, change the history over and over, and this patient is reliable, go with the information you attain, hopefully, right? And that can change a lot. And I've seen innumerable patients that we've been able to avoid unnecessary testing, unnecessary side effects, just by going through the basics. So don't get so excited whenever you hear a story about a patient, because sometimes you go at bedside and it's a completely different story, right? So you have always the right to say, give me a moment, I'm going to review the chart, or give me a moment, let's please evaluate this first and tell me how it is, or give me a moment, I will speak to my attending. When do you bring your attending in? When you think it through and you're like, this might be a risky situation. Like, I know this patient needs a heparin drip, but I know if I anticoagulate this patient, the bleeding risk is very, very high. I'm not sure if I should do it. So don't play Rambo here, okay? And just reach out to your attendant, and your attendant will ask you questions that you maybe weren't even thinking of. Your attendant will ask you, okay, so I don't know, the attendant will see, okay, what's the has blood score? And maybe you didn't know about that score and you calculated and you're like, oh, it's a 2. So why was I thinking this patient was a high bleed score? And actually maybe the patient was not a high bleed score. Okay, so, so maybe we can start it. And that's it. You bring your attendant on board whenever you have a question that you cannot answer yourself, right? And that it's not easily attainable because you also have resources that are trustworthy, such as open evidence, up to date, etc. It's not that you'll do something you've never done just because up to date says it. No. But if you have you're on the fence and you're like, was it 6 milligrams or was it 12 milligrams? So then you use resources. Okay, let's see what up to date says. Okay, this is the same presentation in my patient. Yeah, it's gonna be this amount of milligrams. Okay. And always, whenever you're gonna do a procedure or something you've never done in the past that you're not sure if you should do on your own without attending supervision, just ask. Just ask. If you're just in a life and death situation, okay, you've never intubated in this new hospital, and this patient needs intubation, and you happen to be right there, and there's no respiratory therapist, and the nurse is bagging the patient, and they already have the thing ready for you to intubate, and if you don't intubate, that patient will be in hypoxia for a couple more minutes, several minutes. Okay, there's a moment that you think to yourself, if I don't do this, this patient is just dying, so I'll have to do this, and then I'll have to deal with some consequences, but anyone would understand that this was the only way to go to save this patient. Okay, but if that's not the case, you have a couple minutes, just call for help, make sure you have help. And remember that the attending is also being paid to help. So yes, even if they are at home and all that, it doesn't mean that you cannot ask for help. Even if, yeah, they have I don't know, they're at home, they're also being paid. So you just call. You don't want to end your entire career, your entire future, just because you were afraid of calling. You didn't call, and then this patient had a horrible complication or adverse effect of an order you put in or something that you did not act upon. Then no one will save you in the court of law, and no one will save you just because, oh, poor him, he just didn't want to call the attendant. No, that's not going to happen, right? You have to call the attendant on those scenarios. Yes, I had these situations in Costa Rica that if I called my attendant, like, they were pissed. Not all of them, of course, some of them, but some of them were like, why are you calling me? Like, can't you just handle the code? I'm like, I'm sorry, I didn't mean to call you, and something like that, right? Which it happens, and don't take it personally. Not a good idea to start arguing unless this will recur in future events that might affect patients down the line. Maybe you have to think about the most emotionally intelligent way to be able to share this information or even report a problem, okay? And I think that's the most important things you need. So prepare. It's better to be over-prepared than under-prepared. So if it's your first call and you're just taking a little fanny pack, you're not prepared. Like for your first call, I want you to take almost a check bag in case you need anything in there. Yes, take a little pillow, take a night thing in case you get a little bit of rest, take a toothbrush, take a meal, take a protein bar, take your stethoscope. Maybe you have a pulse oximeter. Maybe that might help. Take all those things. Take the caliper. Take all those things. Take the chargers. How to charge your phone. How to charge maybe your watch will come in handy. All those things. And if you don't need them, you didn't need them. After your first couple calls, you'll know, okay, I don't need a check bag. I can do a carry-on, right? Or I can do maybe a backpack and something else, or you'll figure it out. And that's it. Any questions? Anything? We're here to help out. And yeah, I hope this ages well. And I'm very glad to be in the place I'm at. I'm proud. I'm happy. And I think like it's an honor to work with great people, such as the ones I am working with right now. We're just gonna keep on digging as we've always done. And anything you need, reach out to me. I can give you recs on anything that has helped me in the past. Usually I make a video of. So see you in the next one. Peace.